We are covering latex allergy recognition and management for the phlebotomy exam. On this exam, you must be able to distinguish between the two primary types of latex reactions. A type 1 hypersensitivity is an immediate IgE-mediated reaction. This is the most dangerous type and can lead to anaphylaxis, with symptoms like hives, swelling, wheezing, and a drop in blood pressure appearing within minutes of exposure. An exam question might present a scenario where a patient suddenly develops difficulty breathing and urticaria immediately after you apply a latex tourniquet. You must recognize this as a potential type 1 reaction. In contrast, a type 4 reaction, also known as allergic contact dermatitis, is a delayed response. Symptoms such as redness, itching, and blistering develop hours or even up to 2 days after contact with the chemicals in the latex product. A common exam trap is to confuse these two. Remember, type 1 is immediate and systemic, while type 4 is delayed and localized to the skin. Another critical area tested is cross-reactivity, often called latex-free syndrome. The proteins in latex are similar to proteins in certain foods, meaning a patient with a latex allergy might also react to foods like bananas, avocados, kiwis, and chestnuts. An exam question could ask what dietary history is relevant for a patient scheduled for a procedure in a non-latex safe environment. Knowing these cross-reactive foods is key. The most fundamental concept for the exam is prevention. This starts with patient screening. Before any procedure, you must ask a direct question like, "Are you allergic to latex?" This simple step is a critical safety measure and a frequent topic on certification exams. If a patient confirms a latex allergy, your immediate action is to use non-latex equipment. This includes nitrile or vinyl gloves and latex-free tourniquets and bandages. Exam scenarios will test your ability to select the appropriate alternative supplies. For patients with a known severe type 1 allergy, you must also ensure a latex-safe environment. This means removing all latex products from the immediate area to prevent exposure to airborne latex particles, which can be aerosolized from powdered latex gloves. A question might describe setting up a room for a known allergic patient, and you'll need to identify all necessary precautions. For a simple way to remember the most common cross-reactive foods, think of the acronym BAC-C-K for banana, avocado, chestnut, and kiwi. If a patient reports an allergy to any of these, your suspicion for a latex allergy should be high. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.